Okay, come back with me, yeah, Burhan. Uh, I'm the Stomatal Therapist nursing. Yeah. Today, I will be sharing about the pressure injuries hospital acquired skin injuries on the COVID-19 patient. Because the COVID-19 patient are the very short on the oxygen, the critical times, and having to have total bed rest, which cause the pressures and pressure sores or the pressure injuries which they will worsen the condition of the COVID-19 patient. Uh, my name is Burhan and Ostomy Therapist Nursing, and I'm certified medical nursing. Okay. Disclaimer: the content the presented in this the slide and this the presentation are the opinion of the speaker and do not necessarily reflect the opinion of this current application and institution. They are for the scientific for the discussion only and are not recommended for the off-label the recommendation. And I have our image of the people the presented in the slides or the speaker have the obtained the proper the consent and do not bridge the data of the Indonesian. Okay. Point of discussion to share the current the situation of the patient with the COVID-19 who occurred the pressure injuries and the other related skin injuries. Because the comparison for skin injuries and the pressure injuries for the management. And the point two, to share and discuss the preventive and the treatment option for the certain type of injuries in the given the situation, and to be able to discuss not only the pressure injuries, but also other the type of the injuries that the COVID-19 patient might occur during his or her the hospitalization. Okay, COVID-19 and the critical care. Okay, due to pandemic, the return around the time of attending to patient and in the critical care setting become the longer, particularly to special service and the other allied health service to vary the increase. The people who are the at high risk of the developing the pressure injuries and the other skin injuries is not only the patient, but also includes the healthcare worker as well. Okay, the very increase the health of the patient positive to COVID-19. And point three, the use of personal protective equipment or the PPE has the become of the major risk factor for the health workers. And the quality of care was the compromise due to the nurse to patient ratio. It also includes other health provides as well. The very strong for the quality of care of the patient from the nurse. Maybe COVID-19 and critical care. Okay, the comparison pressure injuries and the skin injuries. Okay, the one, the pressure injuries, the allocation damage to the skin or underlying the tissue. Okay, very the comprehensive. And as a result of the pressure or the pressure in the combination with shear, the pressure injury usually occur over the above the prominence, but may also be related to a medical device or the other objects. Okay, from ATT, okay, medical device related to pressure injuries, and the PPE related injuries are among the most common the classification observed during the pandemic COVID-19. Cause the tissue injuries. Okay, the skin injuries, the fall, the cause, the moisture associated skin dermatitis, okay, the medical adhesive related skin injuries, and incontinent associated dermatitis, and establishing catheter related skin injuries or infection. This is the infection for the skin, okay, from the dermatitis, for contact, and atrophy, medical adhesive related skin injuries for ATP, for the abrasions, and from the medical adhesive. And incontinent associated dermatitis, uh, fecal or urine the incontinence that cause the skin injuries, the erythema for the skin, and uh, infection for the skin, and the pressure ulcer, and the infection system. The strangulation together related skin injuries and the infection. Very, very strong and very impressed management. Hospital accurate the injuries reality with the forgot to access and monitor other types of the hospital acquired skin injuries. Other types of the skin injuries are the visible as the pressure injuries. Okay, the one point, remember, is the common and significant problem. The frequency 5,093% to 60%, and incident 3 until 4% to 93%, and the 42% incident in acute care, and the point for 36% incident in ICU, intensive care unit. The very reason to management for the nursing. Okay? And this the condition is associated with negative outcome. This is the pain, secondary infection, external and internal force, the infection control, the pressure injuries, okay, and the patient and family classification. Always the one that we look and assessment tool pathways. Okay, this is the picture from the pressure injury from to complete pressure ulcer. Hospital acquired injuries. Common hospital acquired injuries of the patient at the critical care setting are occurrence. Okay, this is the picture one, the medical defense related to pressure injury or ATT, and the incontinence associated with dermatitis from the cause, the incontinentia urine and incontinentia fecal, and the medical adhesive related skin injuries. Okay, the MARSI. This is the uh, very strong and very increased to the cause the wound from the phlebitis or the skin injuries. Okay, the 18% of the group of the 222 infants and children in acute facility M.Kep related stripping on the single day adult. An incident of injury associated with adhesive tape 1.5 until 5% incident density, 38% per 1,000 person days in long-term care setting. Specific manifestations include the contact dermatitis of 7.1% and the trauma 21% and infection 9%. Okay, this is the according from the Kaiser and the Big Man 2017 from the Journal of Tissue Viability. Okay. And the contributing factor, the figure from factor associated with increased rate of the pressure into the rise. Pressure impaired the mobility, and impaired the activity, and impaired sensory the perception from the patient. and the tissue tolerance, the extrinsic factor, the management of the moisture from the skin, okay, and the shear from the patient, the transportation, and from bed to bed patient, and the friction from the patient, and intrinsic factor from the management nutrition, because uh, patient decrease for nutrition. This is the very for patient nutrition and vascular and angiogenesis from the skin, the very decreased. And demographic patient and oxygen delivery from nutrition, the combination and correlation from nutrition oxygen to increase the fibroblast angiogenesis from the keratogenesis, the immigration from to heal. And the skin temperature, this is the very important because the temperature uh, 2% Celsius. This is the delay from the wound healing and the management of chronic illness. The Pan-Pacific the guideline from the preventive and the management of the breach of 2019. And the contributory factor of the COVID-19. Okay. Number one, contributory factor. The pressure impaired the mobility and impaired the activity and impaired the sensory perception. Why? Because uh, of the critical condition uh, and unstable details of the patient explaining as the schedule is a challenge, or the activity related to the therapist and range of motion exercise also limited. And the exercise, they are to the many the contraception attached to the patient. Okay. Due to extrinsic factors, the moisture balance patient vary the control, no hyper moist and no dry from the wound base, because this is the very the increase and the impact for healing very increase. And the shear the cause in the pressure from the pressure ulcer and from the wound our skin tears and the friction, shear and friction. COVID-19 this is the increase in incontinence associated dermatitis incident to the during around time it's attending incontinence episodes. Okay, and there's two patient ratio, availability of nurse assistant, and other allied called the professional. Most are also infected by the virus. This is the very decrease from the management extrinsic factor, moisture balance and shear, and the friction from the wound. For the management, the pressure ulcer or the pressure injury. Contributive from the factors the three. Intrinsic factor, nutrition, demographic, oxygen delivery, skin temperature, chronic illness. This is the very increase from the wound healing the patient. This is the from the pathophysiology from the wound. Okay, why? The COVID-19 patients are referred to a nutrition or a deactivation. No issue on oxygen availability, but we have the problem on the ventilator and high flow device because they vary the cause from the skin, okay, dermatitis, and in the increase in the MRSI medical adhesive related skin and injuries due to the number of the contraception transferred to the patient, and mostly we have the medical, the adhesive skin tips, and the particular prevalence rate in facial injury from the patient. The chin 20%, cheeks to 23%, presence of nose 69%, and ours, okay, 30%. This is the very the increase for the prevalence for the facial injuries from the COVID-19. The common location of injuries. This the very long and the very increase for the elbow, inner the tennis, head, elbow, shoulder, back, offhand, the parts, and heel. This is the shoulder, stretch, occipital area, sacrum, ears, chest, and the tracheal tube area, skin trees, and heels. This is the very interesting management to the prevent pressure injuries from the location, from anatomy, the human. Okay, this is the from the Marcy medical of the superlative skin injuries. It tells the frequent application of the medical adhesive device on the same location. And moisture are the treatment in the medical adhesive device. Okay. Prevention and the treatment. Use of the skin barrier prioritize to the application of device because the skin barrier is the foundation number one to prevent wound skin tips or the skin injuries. Okay. Number two, the ensure that area has not access moisture barrier to take the application and inspection of the site as necessary. Okay, and follow a protective guideline and protocol medical adhesive. Okay, and remove that. Marcy medical adhesive related skin injuries, monitoring device, cable, and attachment. Okay, and big application. Okay, the cause prologue use the of monitoring the device, and number two to trap the moisture inside the device. Skin, sweat, and swollen. Edema cause strings because the very increase to skin injury. The cable wires are underneath the patient, the body, or the any body parts. The preventive, I'm sorry, and the preventive and treatment monitoring of a device are the attaching them on at the different location to at the least of locked area and to ensure that the cable wires of the mounting device are not placed at the patient the pressure point. Pressure injuries to the product mounting and medical device. This is the very the increases. This is the from the face, noise, from the occipital, from the skin injuries, from the ventilator, and the early. Okay, this is the very management from the patient, preventive the pressure injuries. This is the my case. The pressure injury due to prolong the proning the device, medical device, the cause due to unstable condition of the patient with the COVID-19 and they in the prone the position for a long period of time, step by step from the healing from preventive and care from the ventilator. Attachment the medical device which and are the pellets and the polyprominent areas, the pressure and the friction. And the preventive and the treatment for the patients who are in the prone position, we are the mid and the improvise running the pillow which overloads much of the facial bony areas, and the application of the hydrocolloid of the certain forms prior to application of hydro device, CAIP and B.Kep markers. and the application of the skin barrier. Because from the face, the always day by day from the nurse or the health service, the application, the mask, this is the very increase to skin injuries. Uh, and the solution, application of the hydrocolloid, the preventive of the skin injuries of the patient. Okay, and the step one. This is the measurement of the pressure injuries, the skin injuries. The step one, the skin cleans. Okay, or the cleansing. Okay, the moistures, the very control. No hyper moist and no dry, because this is the interest wound healing, because temperature from the wound base the same from the body for human. And the three, the skin barriers. Skin barrier remove and the prevent from the infection external, and the two, prevent from the dry from the patient. Okay, and hyperoxygenation oil. This is the hyperoxygenation. This is your application, hyperbaric oxygen therapy. It's okay. Also, and hemoglobin spare, the very good from the healing, the fast for wound healing in patient. Lotion to control moist in the skin patient. Zinc oxide cream. Uh, okay, and offloading device. This is if patient uh, cause the pressure outcome from the foot, okay, plantar foot, and he provides at the mattress with turning schedule. And the step two, the skin cleanser. Okay, this is the polyhexane or the octidine from the wound cleansing, and hydrocolloid for the DACC from the decrease from reduce the bacteria from the skin, and the foam to absorb this if exudate from the patient increase, because the increase the uh, exudate to cause the maceration from the wound, and the wound base the big size. Okay, this the management from the exudate, very very important with the fox application. Hydrofavor, this is the very good. This is an alginate from the blood granulation, from the granulation, and the support from the hemostasis formation. Zinc oxide cream to the autolytic python or uh, the moist from the base, and the impregnated tool dressing. This is recommended or no. You discussion from the medical doctor and the nursing and the ostomy practice in the institution or the hospital. This is the discussion from the medical doctor or the nursing expert in the expert science or the competence and the wound care, and the hydrocolloid and the mattress and the turning. Yeah, the incontinent associated dermatitis, skin cleanser, the same skin barrier, skin zinc oxide, the cream, and after the incontinent episode, the very very management from the incontinence urine from the synaptical from the this patient and the nursing, and frequency inspection of the perineal area from the incontinence vehicle. This is the bottom of the schedule, and the final from the management, the MDRPE, medical device related pressure injuries, the profile medical device selection, the application from management, and the very good and very important from the application skin barriers from the application cable, ventilator, or the patient, and the skin, the proper the medical device removal, and the adhesive removers, proper adhesive tab selection, and proper tab application. This is the very long the application for patient. Uh, the cause wound pressure injuries from skin. Okay, this is the very important for nursing or the health service to management patient preventive or the prevention from the skin injuries to patient. Quality of improvement measurement, surveillance and the monitoring, creation of assessment and the monitoring tools to aid the healthcare workers in monitoring the COVID-19 patients who are at risk. Okay, training and dissemination from the guidelines, assessment tools. I will explain it to the users and how the referral system will work with all of the terms and the monthly update and the reporting of finding the patient and the clinical pathways and the guideline for the standardization of the treatment and management certain injuries for the better outcomes. Review the current for day by day and skill training course from the pressure injuries assessment to use the scale Brandon 1, 2, 3, the application is okay. But the skill from the nursing, the increase from the skin injuries. Okay, the Marty, moisture associated related skin injuries from the cable, from the ventilator, the tape, the skin barrier, the patient, and ERD from the control incontinence, fecal, and urine to the snum kegel, examination kegel, or uh, the treatment of the incontinence and urine on fecal. The preventive and the management considering the evidence and the best practice from the guideline, the organization, and the evaluation and the revision of the protocol. You're writing research, you're reading the best practice, the guideline from the patient, and from the protocol outcome-based treatment. And annual review and revision, the creating team or the committee that while the informal different the specialty in the file. My conclusion, help the practitioners must only the focus on what is the current and the common injuries for patients and the critical areas, but must also consider other the skin injuries that can be a complicated problem in the future, especially for the COVID-19 the patient. Marcy, yeah, the pressure injury might have the similarities, and this the manifestation, the appearance parts. We must closely look at the distinct etiology and the pathophysiology from the skin injuries of the aids to determine the correct management increase. And the final, the third time guideline and the protocol can be the great help not only for the health, the practitioner, from the patient as well, this of the expected good outcome to application to use the guideline and the protocol best practice from the organization to hospital or from the nurse. Okay, thank you. This is my thank you for your attention and goodbye.